Hey everyone, welcome back to the channel. Listen, I know how stressful preparing for the NCLEX can be, especially when it comes to Medsurg nursing. There's just so much information to remember. So, to help you crush your exam, we're going through 10 must-know NCLEX style questions. These questions are designed to test your knowledge on key concepts and help you feel confident walking into that exam room. Let's jump right in and get those brains working. Alright, first up, we're tackling COPD, a chronic respiratory condition that often leaves patients struggling to breathe. Imagine your patient is experiencing shortness of breath. What's a simple yet effective technique you can teach them to gain better control of their breathing? That's right, pursed lip breathing. Think of it like blowing out birthday candles, nice and slow. This technique helps to keep the airways open longer, preventing air trapping and allowing for better oxygen exchange. Remember, for patients with COPD, every breath counts, and pursed lip breathing can make a world of difference. Let's talk about post-op hip replacement care, a critical area in Medsurg nursing. You're doing your rounds, checking on a patient who recently underwent a hip replacement. As you're assessing them, you notice one leg appears shorter than the other. Alarm bells should be ringing, my friends. This could be a sign of hip dislocation, a serious complication that requires immediate attention. Don't hesitate to call for help, get that patient back into bed safely, and notify the doctor immediately. Early detection and intervention are key to preventing further damage and ensuring a smooth recovery. Next up, let's talk about diuretics, medications commonly used to treat hypertension and fluid retention. While effective, diuretics can also lead to electrolyte imbalances, specifically hypokalemia or low potassium. Why is this important? Well, potassium plays a crucial role in muscle function, especially in the heart. So, imagine you're monitoring a patient on diuretics. What's one of the most important lab values to keep a close eye on? You got it, potassium. Regularly monitoring potassium levels helps prevent potentially dangerous cardiac complications. Now let's talk about diabetic foot ulcers, a common and serious complication of diabetes. Imagine you're caring for a patient with diabetes who has a foot ulcer. During your assessment, you notice a foul odor coming from the ulcer. This is not something to be taken lightly. A foul odor often indicates infection, which can quickly escalate in patients with diabetes due to impaired wound healing. Remember, early detection and treatment are crucial to preventing serious complications like amputation. Never hesitate to report any signs of infection to the healthcare provider. Next, we're diving into pneumonia, a respiratory infection that causes inflammation of the air sacs in the lungs. Now imagine you're caring for a patient diagnosed with pneumonia. They're struggling to breathe, coughing, and running a fever. What's your top priority in their care plan? You guessed it, administering those antibiotics as prescribed. Prompt antibiotic therapy is crucial to target the bacteria causing the infection, reduce inflammation, and ultimately help the patient breathe easier. Let's shift gears to chronic kidney disease, a condition characterized by the gradual loss of kidney function. Now imagine you're reviewing the lab results of a patient with chronic kidney disease. You notice elevated levels of blood urea nitrogen, BUN, and creatinine. What does this tell you? This indicates the kidneys are not effectively filtering waste products from the blood. Monitoring these lab values helps assess kidney function and guide treatment decisions. Next up, we're tackling hypertension, also known as high blood pressure, a major risk factor for heart disease and stroke. Now imagine you're educating a patient newly diagnosed with hypertension on lifestyle modifications. What's one dietary change you'll emphasize to help manage their blood pressure? That's right, minimizing processed foods. These sneaky culprits are often loaded with sodium, which can contribute to elevated blood pressure. Teaching patients to read food labels and choose fresh, whole foods is crucial for long-term blood pressure management. Let's move on to post-operative care for a cholecystectomy, the surgical removal of the gallbladder. You're assessing a patient after surgery, and you notice their abdomen is distended and they're complaining of pain. What's your next move? Abdominal distension can be a sign of complications like bowel perforation or obstruction, which require immediate medical attention. Always trust your gut instincts, and don't hesitate to escalate your concerns to the healthcare provider. Now, let's talk about warfarin, an anticoagulant medication used to prevent blood clots. While effective, warfarin can also increase the risk of bleeding. Imagine you're providing discharge instructions to a patient prescribed warfarin. What's one crucial safety precaution you'll emphasize? Teaching patients to recognize and report any signs of bleeding, such as unusual bruising, nosebleeds, or blood in the urine or stool, is paramount. Early detection and prompt medical attention can help prevent serious bleeding complications. Finally, we're addressing mechanical ventilation, a life-saving intervention for patients who are unable to breathe on their own. You're monitoring a patient on a ventilator, and their oxygen saturation alarm goes off, reading 89%. What does this indicate, and what's your immediate response? An oxygen saturation of 89% indicates hypoxemia, meaning the patient is not receiving enough oxygen. This requires immediate action. Check the ventilator settings, assess for any obstructions, and be prepared to administer supplemental oxygen as needed. Remember, maintaining adequate oxygenation is crucial for patient survival. That's it for our top 10 Medsurg NCLEX style questions. I hope this rapid-fire review helped solidify some key concepts and gave you a boost of confidence for your upcoming exam. Remember, you've got this. You've put in the hard work, now it's time to show them what you know. Don't forget to like this video if you found it helpful, and subscribe to the channel for more nursing tips and tricks. And as always, stay happy and healthy. Best of luck with your NCLEX. You've got this.